This is what the slide may look like if you had an inherited retinal disease. Good morning everyone, my name is Nicholas Ponticus and I am a researcher at UCL and Moorfields Eye Hospital, where I specialize in the genetics of inherited retinal diseases. My proposal, Arthogene, is to develop a web tool powered by machine learning to streamline the genetic diagnosis process to make it more efficient and accessible. Inherited retinal diseases, although individually rare, affect around 25,000 people in the UK, and in fact they are the leading cause of visual impairment in the working age population. They are diseases caused by mutations in a single gene, for instance here the USH2A gene, and these cause deterioration of the back of the eye, which we call the retina, as you can see in this image. Finally, finding the genetic diagnosis cause of a disease, also known as finding the genetic cause of the disease is crucial for advising and managing patients and recruiting them to ongoing gene targeting trials. However, there are currently a number of limitations with the genetic diagnosis process, which means it's both expensive for the NHS and more than 60% of patients, more than 40% of patients don't get a genetic diagnosis, even at the leading centers in the country. So these limitations are namely that there's a shortage of experienced specialists, that the genetic diagnosis process can take a long time, and incur costs up to £10,000 due to expensive clinical tests. During this process, there's little information fed back to the patient. So using machine learning web tool Arthogene, my goal is going to be to address these issues and improve the efficiency of the process. These improvements are going to be achieved using machine learning by replicating the three genetic diagnosis work streams, namely imaging, clinical symptoms, and genetic data, and combining these to obtain a consensus diagnosis. In my first year, I'm going to use the 28,000 retinal images from patients with known genetic diagnosis. As you can see here on the right, the labels are the gene names. And I'm going to use these to train a neural network so that given a new retinal image, I can predict the genetic diagnosis probability. This will be released as a web tool at the end of my first year. In the second year of my fellowship, I'm going to extract clinical symptoms from the 32,000 electronic health records from patients with genetic diagnosis and encode the symptoms using standardized clinical codes, as you can see here in yellow and blue. I'm going to use these terms to predict the genetic diagnosis by training a machine learning tool known as random forest to predict to output again gene probability tables. This new functionality of Arthogene is going to be added to the website at the end of my second year. And in my third year, I'm going to combine the clinical symptoms with the genetic data. And using the Phenopolis platform I've developed, I'm going to obtain genetic diagnosis probabilities, but this time for individual mutations. At the end of my third and final year of the fellowship, I'm going to combine the probabilities from these three work streams and obtain an overall consensus Arthogene genetic diagnosis, as you can see here in green. This will be the final release of Arthogene and made available as a web interface where one can upload data and obtain a predicted genetic diagnosis. There's a demo version of this website already online that you can access at this address. During my fellowship, my training and development plan is going to involve intense training in clinical ophthalmology and text mining in the first year at UCL and the Fire Institute. And I'm going to ask key research visits in labs that wish to collaborate with me on Arthogene. I'll also be presenting my work and networking at genetic and ophthalmology conferences as well as patient public research days. Finally, the outputs of Arthogene are going to be for the patients increased feedback during the genetic diagnosis process with the web platform, a support network and ability to connect with other patients, again with a similar genetic diagnosis, information about treatments and clinical trials for patients who have a genetic diagnosis already. For doctors and researchers, it's going to facilitate the genetic diagnosis process and lead to better care. It's going to also improve the research outputs by allowing them to gain a better handle on the symptoms and gene correlations in different patients. And for the NHS, it's going to save money through less testing, less genetic diagnostic testing, and improved efficiency. And for optometrists, it will be an improved screening tool and retinal and training for retinal image interpretation, and for the public, portal for education and involvement. Finally, for myself, the fellow is going to be a unique chance for me to develop important skills and become a PI to make important contributions to the future of the NIHRs. Thank you very much.